Hi, I'm Jen Steer with the Northeast Ohio Media Group, and today I'm joined by Dr. James Kazura, who is the Director of the Center of Global Health and Diseases at Case Western Reserve. We've had a lot of news today on the Ebola front. A woman who was a nurse in Dallas traveled to Cleveland Hopkins International Airport and back. She also visited some family in Akron recently, and this has brought the Ebola concerns to Cleveland and the Northeast Ohio area. So Dr. Kazura is going to help us get through some of the information here on Ebola and have us understand it just a little bit better. So thank you for joining us today.
You're very welcome. Happy to be here.
So your area of expertise then?
So I'm the director of the include the kind of classical tropical diseases that people think about, like worm infections and malaria, of course, but also includes some viral infections. We don't specifically examine Ebola, but we've done work on other viral hemorrhagic fevers that are important in sub-Saharan Africa. That's not the topic of today's discussion, but many of us over the last 30 years certainly work in various areas of Africa on these superficial, at least, exotic infectious diseases, which are actually very common in sub-Saharan Africa, but are relatively new from a North American or European perspective.
Okay. And this concern, this has only been brought to our country recently.
Yes.
There was the confirmed case in Dallas, and now the second case of a nurse who contracted it. Is this surprising? Is this...
It actually isn't surprising. You have to cut through a lot of the, certainly concern about things that we don't know a lot about in this country, we don't hear a lot about. But I think the concern here now is that it's understandable that people could come to this country and unknown to be infected, and then like this gentleman in Dallas who actually died from it. We've had some actually healthcare workers from West Africa who have come here to Emory at the University of Nebraska for treatments, experimental treatments of these things. But these are the first two cases that have actually been transmitted clearly from someone who was infected elsewhere, now transmitted to someone in a situation in a healthcare setting, analogous to some extent what happened in the early days of this current epidemic that was started in West Africa in July or August, or even probably earlier than that.
And a lot of concern we're seeing is for the healthcare workers.
Yes.
Nurses' unions have been speaking out that there
Sure.
necessarily aren't the protocols or procedures in place to stop the spread of Ebola or even to treat those patients. Is that kind of what we're seeing now? Is that maybe there weren't policies in effect?
Well, I think the policies have been in effect. As we all know, in American hospitals, this is a whole nother level of isolation, and unlike we use isolation where people get infected with organisms that are resistant to antibiotics, and in hospital settings, nurses, doctors, other healthcare workers are very well attuned to that so they don't transmit that from that infected individual to another person in a hospital or to their family members. That still can theoretically happen, but it doesn't happen much. But in here, there's so little room for any error in this type of thing. At least the public doesn't have any current knowledge of precisely why these people got infected. But first of all, both of these people took care of someone who was very, very sick and ultimately died. And the man who died in Dallas was undergoing dialysis. I understand he was intubated. He had a breathing tube in. Nurses have to clear out secretions and everything. So there were probably millions and millions of viral particles in there. So the chance of being infected just increased by the absolute volume of virus that the people could be potentially exposed to.
And a lot of people are worried on how this virus is transmitted. I mean, there's a lot of misinformation,
Yes.
And it's kind of similar to like the AIDS epidemic.
In the early days, I remember that exactly. Right.
So exactly, lay it out on the line, how this is transmitted.
Okay, so this virus, first of all, let me say how it's not transmitted. Now, I'm talking about today. Now, so,
Yes.
you know, anytime you talk to a scientist or anything, they say, well, I can say this with 99.9999% certainty, okay?
Yes.
So that's where I'm going from, okay? So I'm not trying to provide wiggle room, but that's the reality of biological agents that can evolve over time.
Yes.
But right now, there is absolutely no evidence at all that this can be transmitted by the respiratory route. So if I'm talking to you now, I'm about 2 or 3 feet away from you. If this was flu season, or if we were in a population that didn't have measles, just the fact that I'm talking to you, you get aerosolized particles, okay? Viruses can be carried in there. I could be transmitting that to you right now, okay? This is why people get more flu during the winter. It's closer quarters. That's respiratory tract transmitted. There is absolutely no evidence now or in the past there's any respiratory tract mode of transmission.
So a simple cough wouldn't necessarily do it.
If a cough and if the person had bleeding in their gums at the same time, okay, yes, then, but you're talking about aerosolization of a body fluid as opposed to, okay, so there's even, so it's primarily a blood-borne virus. That means it can be found also in other secretions such as saliva. Certainly when the people who die of this disease, it's called a hemorrhagic fever virus. But only less than 50% of people actually have overt bleeding. But they have voluminous diarrhea, voluminous vomiting. And so just by the fact of doing that kind of thing, the gastrointestinal tract is damaged. So you can have small bits of blood, which may be only microscopic, but if you deal with something that's like quarts of vomitus or quarts of fecal material, or dialyzing someone, the potential infectious inoculum in the healthcare setting where someone is potentially can die of this because they have such an overwhelming level of number of viruses, just increases the chances of being exposed to it. So normally, I have a few scratches on the top of my skin here, which I got a few days ago. I think I was cutting something in my yard. So if I would that's a way of transmitting skin to skin, for example, okay? So it really takes fairly close, intimate contact with various body secretions, okay, but not by the respiratory tract.
Okay.
And
that's what puts the healthcare workers at such greater risk.
Right, because they're taking care of some of the sickest of the sick people, okay? And this is what happened in Africa, and it still is occurring now. I mean, and we read about recently in Sierra Leone that the healthcare facilities are totally overwhelmed, so they're trying to have people quarantine in their own homes, and they're giving them things to give supportive care for the family members to give it, but you can be certain that that will not stop the transmission. That's a depressing turn of events from the African perspective.
So in the case today that we're dealing with, I know they've talked a lot about disinfecting the plane, cleaning the plane.
Right, that's totally appropriate.
What kind of, what would kill the virus on a surface
Or
and why?
Chlorine, okay, so chlorine, and this is like chlorine bleaches and stuff like this. And I'm not an expert in what happens to airplanes, you know, at the end of the working day, but I believe a lot of these solutions are used because there's other germs that could be, you know, if it's in flu season, or some viruses, and this does not include the Ebola virus, can remain viable for actually several days or a day or so on some inert surfaces. So that's one of the reasons they do this with routine airplane maintenance, not just here, but anywhere, any international flights have that type of thing done.
So chlorine bleach,
right. So
those types of chemicals?
I have a colleague who is going to visit New York tomorrow. She called me during the day. She wasn't here today. She said, do you think I should cancel my trip? And I'm not making this up, because I'm going with my daughter to New York for a holiday for 3 or 4 days. And I said, I could say confidently, there's no reason that she shouldn't be able to take that trip because of the airplane exposure type thing.
Yeah, and that's the type of question a lot of people have been having, that exact question.
I asked that question myself. It's not a scaremongering question. It's a totally appropriate and logical question that people should ask.
Now, we've been working with Frontier to try to get information. They said that the plane might be back in service just today. Should that cause any fear, or should?
No, I mean, the spraying antiseptics and stuff like that, or the chlorine stuff, this virus is known to be killed very rapidly by any kind of chlorine spraying. That's what they do with equipment that they want to reuse. I can't give you the % chlorine solution, but there's standard ways that this eliminates the virus, and that's a scientific fact, a hard fact.
Yeah, I'm looking real quickly at some of the questions we have on our website.
Sure.
Before you came on, I made sure to ask our readers if they had any concerns with the current news. And of course, this is not something we're used to dealing with in a westernized society.
Absolutely true.
This is something more.
I think people in developing world are not used to dealing with something of this magnitude that's going on right now in West Africa. So it's even unusual in situations where you would anticipate this would occur more frequently.
All right, and one of the questions I'm looking at here, a few family members of the Dallas nurse that was in our area, they have to self-monitor?
Yes.
Is that something that's typical?
This is what ideally is done. So depending on how close she got to these people, if people share toothbrushes, when you brush your teeth, there's always a small amount of blood that you can actually detect this. Okay, it's because the gum is damaged. Okay, does this person share toothbrushes and stuff like that? I mean, I don't know what these people's personal habits are, but those kinds of things. So what we know about this is that from the time the virus is inoculated, it takes at least the longest that's been observed empirically, that is by just observing people who live in these areas, it's 21 days. If you're going to develop the disease, it'll appear within 21 days. And that's done by daily temperature monitoring, which is, I think, probably the nurse that's in Dallas now. And I'm not talking about the case the first woman who was infected.
Because there have been two nurses.
Right, so she was clearly attuned to it, and she did the right thing. I don't know this, but I suspect she was monitoring her temperature, had a very low threshold for it. Now, there's a lot of things that can cause an elevated temperature, of course, other than Ebola.
Yes.
And if this is flu season, it would even be more complicated because for every one possible Ebola case, there could be hundreds of influenza cases during the flu season.
And that brings me to another good question. When it comes to flu season, because that's not that far off, is this going?
I've had my flu vaccine, and I would recommend.
What is the difference, though, and are we going to see a lot of people with the flu who panic and think it's Ebola? Or should they be a little bit more perceptive?
If this was January and I hadn't had any contact with Ebola patients in their care, direct care, proximity, the chances are 99.99% that it's influenza. You can reduce those chances by getting the flu vaccine, okay? There is no Ebola vaccine now, and even if we had it, I can't imagine how would we deploy something like this to protect the whole country? It's not really possible.
No, that's not feasible.
It's not feasible.
It's hard enough to vaccinate for flu virus.
And stuff like that. So the ideal test, and I'm certain that people are working on this, and I can't give you details about it, is you would like a point-of-care diagnostic test. So if, let's say, people got on an airplane and someone had an elevated temperature, okay, so presumably now those people will then be quarantined like in Newark or in Washington, which is what's happening from flights arriving from one of the 3 West African countries, okay?
Yes.
Okay, so I'm a tropical medicine expert. So if the person was in West Africa for the last 3 weeks, but they had nothing to do with Ebola patients, and they came in the country with fever, and they're, everybody's truthful. Of course, no one wants to hurt anyone else, and they want to get the best care that they can. The chances are they still don't have Ebola if they hadn't been working in one of the clinics, okay? So my guess is they probably have malaria or some other virus that is not going to kill them. But if you could get a finger prick blood sample or a salivary sample and then tell by a strip test, it turns purple, it's positive, it doesn't turn purple, it's negative, okay? Is this Ebola or is it something else? Those type of tests for Ebola are not currently available now.
Those types of instant tests.
Instant tests.
Because
but you can detect the virus by amplifying the nucleic acids in the virus. It's not I don't know what it costs, but it's not a widely used test, so you can guarantee that it's not going to be inexpensive. But take the cost out of the situation. It's not instantaneous, so it puts
there's a larger window.
There's a larger window,
and to be exposed.
If someone is and like this man who came from Dallas, let's take this situation that he was actually asymptomatic. Let's say he wasn't sick when he, actually, I think, as I recollect, that's what happened. He came from West Africa, he arrived in Dallas, he wasn't ill, then he got ill a day or several days after he arrived. So it wouldn't even been detected by this fever kind of screening at the airport if in Dallas or wherever he came in the country, wherever it would have been, okay? So, but he did develop this severe fever and then sought hospital care for that type of thing. So right now, if you could identify that you have that kind of diagnostic test, you might require people to get a salivary test if they had been on a flight that was arriving in the United States from West Africa. But it doesn't exist at the present time. So all we have is this temperature monitoring and then seeking health care. And in most places in this country, you could get the diagnostic done properly, or have it sent to CDC or State Health Lab to have it done.
Yes, because I believe that the Ohio Department of Health is now testing for Ebola, or they have the capabilities
I read that in the newspaper in the Plain Dealer this morning as well. I think that was in the Plain Dealer this morning.
I do believe so.
Yeah, it was, yeah.
When it comes to the flu and Ebola, I mean, we've talked a little bit about it, but there are similar symptoms.
Yes, there are similar. And in many viral illnesses or malaria, at the initial stages of the illness have very similar type of symptoms. It's the way that your host immune response responds to these things, and fever probably evolved as a protective kind of thing to kind of slow the growth of infectious agents that enter our body.
Yeah,
okay?
Fever can mean a lot of things.
Fever can mean a lot of different kinds of things. So the fever is a blunt diagnostic tool, but it's the first step to enter the diagnostic sequence of events, if you follow what I mean.
Yeah, that's why when you go to the doctor's office, the first thing they do is take your temperature.
Take your temperature, right. Take your pulse, take your blood pressure, things of that nature.
And that crosses a lot of items off the list.
Right.
Another question I'm seeing is the fact that this nurse who was in our area, she went on a plane. Would she have been warned not to do that, given her close contact with a previous Ebola patient?
Well, it's hard for me to speculate on what she was told to do.
Would there be a type of policy?
And again, this may unfold as we learn more about these kinds of.
Obviously, I mean, we're learning more minute by minute.
So I presume since she had contact with this patient who died, I presume that she was probably monitoring her temperature every day. And from what I've read thus far, she was feeling well when she got on an airplane to come from Dallas to Cleveland, and then was not ill when she was going from Cleveland to Dallas. I don't know if she actually recorded her temperatures there, but it's within 21 days since she took care of this man who died in Dallas a week and a half ago or so. So I presume she had been monitoring her temperature every day. So, and that's probably what led her to seek the diagnostic test in the first place, right? So I guess that's a long-winded way of saying, with, again, a high margin of certainty, but not absolute certainty, that it's highly unlikely that she was shedding the Ebola virus when she was on this flight. One can't rule that out, okay? But it's highly unlikely. So
it was unlikely that she would have been contagious.
Contagious at that time, right? But again, there's no guarantees about this kind of thing. And there's no intimate contact on an airplane or anything like that. And as I said, the other thing, people are often appropriately concerned about transmitting a virus through the washroom. Okay, a small washroom on back. Like, I'm going to Madrid next week to an infectious disease meeting. Pointing out, if you've been on a long overseas flight, the bathrooms, the flight attendants clean these out and stuff. And if you notice, none of the flight attendants on this flight that this man took from Amsterdam, the guy who died, went from West Africa to Brussels, I believe, then Brussels to Dulles in Washington, and then to Dallas. At least we don't know of anybody who's gotten Ebola that was on that flight or any of their contacts. So I'm speculating on this, but I suspect that there's been some follow-up in the airlines to see. Now, these people are all over the world now, but they knew we were on those flights. We have not heard of any apparent airplane incidents, staff or passengers on a flight where now, in retrospect, this man was on, that we know that.
Well, and given the timeline, shouldn't they have already developed?
You would think it would have declared, but I forgot when that flight was, but if it was more than 21 days ago, then
it might be all in the clear.
Yeah, right. It might be gone. I would believe we would have seen it by now.
Okay. Another thing that keeps coming up is the criticism of the CDC.
Yeah.
A lot of people are pointing fingers saying that they weren't taking this seriously enough in the beginning. Is there anything that they can do to build up confidence or,
I think
or
that,
kind of correct the
okay,
wrongs
well,
that people see?
I think they are doing that now. And I also want to kind of congratulate the way that the Dallas community has dealt with this. I understand when this woman, the first woman who got the Ebola from the patient was identified, they used reverse 911 calls to say there's been a person in the neighborhood who we now have Ebola. What contact? And the mayor came out and walked in this community. So I live in Cleveland Heights. So it was like in the 6-block neighborhood, if Jim Kazura had this, they would be calling these different people. And I think I believe there was no one trying to keep anyone deliberately in the dark. I mean, what would be the purpose of that? And people are naturally very concerned about this for themselves and for their family. But I think we've actually learned in many ways how to deal with this kind of potential release of this virus in our own environment. And the CDC, I think, has now taken this a lot more seriously. I think that we have very sophisticated hospitals in this community, some of the leading hospitals in the country. But we have never dealt with this here. And I would think that'd be something that would be in order to actually not just say, these are the CDC guidelines, go on the website and see it, have some in-house training with this. And I think this is what some of the nurses and other healthcare workers are demanding. And that's a perfectly appropriate thing to do. I haven't taken care of patients of this type ever in my life, and I would want to go through that. And there's these courses that they have in person. How do you take off the gloves? You go in as partners. Because often especially in Africa, the problems come in, these suits that people wear, it's very hot, and even if you wear them, it's hard to breathe in them. They steam up. You can tolerate it and so it's a natural thing to kind of wipe the sweat off your brow and then inadvertently put it in your conjunctiva, or wipe your brow or something like that. So people do this all the time. It's a natural kind of thing. But you can learn different kind of behavior and always have somebody I watch you, you watch me.
And that would help minimize the amount of possible contact.
Anybody who does this, and these are like heroes is kind of a strong way of putting, but these are people who really are into taking care of other people. They care about other people. This is why they're nurses, doctors, and other healthcare people. They really care about other people and are willing to take these risks, so they have a lot vested in the game to be able to continue to do that type of thing.
And that wouldn't be a typical type of training that a nurse in this country or a doctor?
No, it would not. It would not. We have isolation rooms for, as I mentioned earlier, like Staph aureus can be resistant to certain kind of drugs, okay? But that's so you don't spread it to other patients or to your family members. But that's a whole another level of, this is a level beyond that.
All right. Well, thank you, Dr. Kazura, for joining us.
You're very welcome.
And I appreciate you for answering some of our reader questions here. And hopefully we cleared up some information that people were a little confused about. So once again, I'm Jen Steer for the Northeast Ohio Media Group. Thank you for watching.